Hi, I'm Emily Watkins, and this is the WBFO Disabilities Beat. This month, we're sharing highlights from the recently passed New York State budget for 2024 to 2025. This week, we break down how parts of the budget will impact housing, transportation, and employment for people with disabilities. This interview has been edited for length and clarity. However, we have the entire roundtable discussion this is from, which includes more perspectives and additional aspects of the budget on our website at WBFO.org. First, I want to introduce Todd Varwerk. Todd, can you tell us a little bit about who you are?
Well, I'm the Chief Policy Officer at West New York Independent Living. I'm a person with a developmental disability who's worked in the independent living field for 30 years.
And Stephanie, you also work at West New York Independent Living. Tell us a little bit about you.
Hi, I'm a person with multiple disabilities, and I am the Chief Operations Officer.
And tell us a little bit more about West New York Independent Living as well.
So we are a family of agencies, including 3 independent living centers, which support people with disabilities and living a full and inclusive life in the community.
I noticed that $43 million will be going to supportive housing units for people with mental health conditions. Stephanie, I know that West New York Independent Living works a lot with people with mental health conditions and making sure that they have the resources they need to succeed. What have you been hearing about how this might impact people?
Well, I think it is needed. We have such a lack of affordable, accessible, integrated housing. And for this population, it's only a portion of our disability community, but absolutely important to have. And the thing that really stands out for this is that it includes single room occupancy and being able to get housing in non-licensed Office of Mental Health facilities. So that means you can get assistance to get an apartment in the community where maybe you would be in a building with other people that don't have disabilities or mental health conditions. So that's really important to remain integrated and part of society where we're not segregated into specific housing settings, but have access to housing and the supports we need in those housing settings.
Todd and Stephanie, obviously Winnell does a lot of work to help people with housing, getting connected to housing. What are the issues that currently exist right now? Do we see any other ways the budget is helping remedy those issues?
Well, remember that this is part of a much larger push on housing that came out of the governor's State of the State address. And while we're addressing people who are served by Office of Mental Health and what we refer to as an O agency, right? We're dealing with people that are being served by the O agencies, but the people that aren't are still in a housing crisis problem with not being able to get accessible housing because locally all of it's being used. And the housing that you can get is definitely priced out of somebody who doesn't already have a housing support like a federal housing choice voucher or something from one of the state waivers. So like we can say in a lot of areas of the budget, this is a very good initial investment in the most persistently homeless population that the state says that they deal with. But we can't just let it be the only step. So we are advocating with local politicians to talk about the general housing plan, including provisions for accessible housing, so that there's accessible housing to be able to use the money that they're putting aside in this program.
And just to clarify for our listeners, those O agencies are the Office of Mental Health and the Office of People with Developmental Disabilities, or as we call it, OPWDD.
And the other one, the Office of
Addiction Services and Supports.
Addiction Services
Oasis,
and Supports.
Yeah, they changed their name not too long ago.
So the O agencies, but obviously not everyone with a disability is served by an O agency.
Correct.
And some, it becomes a barrier of who's the primary, who's taking the lead. And so let's say you have multiple disabilities and are served by both agencies. Sometimes that could be difficult in getting services at all because, there's a lot of finger pointing going on.
Yeah.
And housing was one major part of the budget, but I know that employment was another major highlight for the governor. And New York said that they are becoming a, quote, employment first state for the disability community and have contributed $6.7 million in the budget for that. Todd, tell us a little bit about what that means for the community.
Well, employment first is meant on a state level to prioritize the ability of people with disabilities to get competitive, integrated employment. This is the first time it's mentioned in the budget in terms of a budget line in a major governmental initiative, but employment first has been around for a while. And hopefully with the amount of money they've placed toward it and the amount of planning they're going to need to use to spend the money, we're going to get some more substantive results in being able to improve employment outcomes. Because while we've been saying employment first for a whole bunch of years, we really haven't been building that into corporate jobs beyond, kind of entry level, maybe maintenance jobs or jobs in government. So we're hoping that this model can build into something where there's a genuine choice of jobs, especially since we're now in a deficit for hiring folks. Everybody's looking for people to fill a job. People with disabilities are great for that. So here's, again, the government making a good first investment to say, all right, if we have all these jobs that need to be filled, let's put some money behind making sure that people with disabilities can get an equal shot at them.
And do we know how that money will be used to achieve that?
Not yet. Budget language has to lead to regulatory language before we realize how they're going to spend the money.
And this year, we saw $323 million allocated to upstate New York transit systems, but no word on any major changes to paratransit.
Now, there's a reason for that, because in last year's budget, in the 2022 budget, they placed $750,000 into a fund for a study to be done by an upstate transit authority about the cost of expansion for paratransit. And they gave the money to the Niagara Frontier Transportation Authority, who is currently pursuing the study. The study is supposed to be done by October of 2024. So with regard to the next budget, we should be able to have a number that's workable and professionally and peer researched so that we can go back and say, all right, for the upstate transit authorities separate from the MTA and everything that they do, because upstate transit is funded differently than downstate transit is. Being able to have a number allows us to get into that conversation about how much paratransit expansion the state can afford. I don't think that it was a failure of the governor's part to consider that, more than I just think that they're, kind of waiting for results. Now, that having been said, as we move forward, we know that the major guy that pushed the study, Tim Kennedy, just won a position in Congress. And one of the things that we'll be leveraging, hopefully from his office, is continued commitment on the federal side, right, to bring in some money that the state could then match, right? So if they say that expansion in the region for paratransit is $20 million, well, then we can ask the feds for $10 million and then only have to worry about the NFTA matching another $10 million potentially with state allocation.
You can listen to the Disabilities Beat segment on demand, view a transcript and plain language description for every episode on our website at WBFO.org. I'm Emily Watkins. Thanks for listening.